Actually, one of the main news regarding breast cancer and hormone replacement therapy comes from a study that was done in Europe a few years ago, and that tried to assess the comparative risk of hormone replacement therapy regimen and actually the impact on breast cancer. And it showed that actually the nature of the progestin compared to the progesterone is actually the most important factor that will either increase or not the risk of breast cancer. And actually what this showed is that progesterone, which is the bioidentical hormone to the one which is produced in the body of the woman, has a protective effect against breast cancer, which is not the case of any progestin. So, and when they did their study, they showed that, for example, if you take estrogen alone, your risk of developing breast cancer is 1.3 compared to the non-user. But if you take estrogen plus progesterone, it is 1, which is no increased risk. But if you take estrogen plus any progestin, the risk is increased. So when we look at that, the risk or the relative risk of getting breast cancer to hormone replacement therapy is much lower than a lot of other lifestyle factors. And moreover, if you take the good regimen, probably you don't even increase significantly your risk of breast cancer while getting all the positive effect of hormone replacement therapy. Moreover, it seems that when you take transdermal estrogen compared to taking estrogen per mouth, you do decrease your risk of stroke. And it seems that also taking estrogen transdermally does not increase your risk of stroke compared to taking estrogen per mouth. So again, we see that the best way to take estrogen is transdermally. Another risk that was showed by the Women's Health Initiative is the risk of having cholecystitis, which is an inflammation of the gallbladder, with hormone replacement therapy. So again, if you take your estrogen transdermally, you do decrease your risk of cholecystitis. So it's another reason why you should take the estrogen not per mouth, but transdermally. So, in summary, we've seen the risks that were advocated by the Women's Health Initiative, saying that you do increase heart disease, you do increase stroke, you do increase pulmonary embolism, deep vein thrombosis, breast cancer, and cholecystitis. But you have to remember it was with the bad regimen of hormone replacement therapy. What happens if you do take you take your estrogen transdermally, you decrease the risk of stroke, which is not more important than the naturally occurring one. You decrease your risk of deep vein thrombosis and thrombovenous embolism. And you decrease also your gallbladder risk, the risk of having cholecystitis, even if that particular one remains a bit higher than it would be normally. Moreover, if you do take progesterone instead of a progestin, it seems that you do not increase your risk of breast cancer in any significant way. Furthermore, if you do take your hormone replacement therapy before the age of 60, then you do lower your risk of having heart disease and dying of heart attack. So all that being said, what happens if you transform the way you administer your regimen of hormone replacement therapy, you start from an increased risk that would be shown here by all these dots that are to the right of the vertical line here, to this distribution where you do decrease your risk of heart disease, of stroke, of hip fracture, of cancer of the colon, and the only thing which gives you a risk which is slightly higher than normal is having cholecystitis or inflammation of your bladder. So we see that by changing the regimen of the hormone replacement therapy, you get much more advantage than risk. And moreover, you have all the quality of life that comes with the fact that you don't have all these night sweats, you don't have that insomnia, you don't have that irritability, that mental fog that usually comes with menopause.